Well, good morning again. I'm going to do a little short lecture on kind of the next part of the respiratory system. We got through the nasal cavities and pharynx. So I'll do a few scribbles on the board, talk about the larynx, maybe we'll get to the trachea and the bronchi. When I'm done with that, I'll go over it again with some real pictures, again, using the models and the diagrams we use from the lab. So you kind of get the lab stuff at the same time. Now, let's see. So we went through the nasal cavities, processed the air and everything, go through the pharynx, again, common passageway for digestive and respiratory system. When you're breathing, air goes through it. When you're eating, food and water goes through it. And then when we get to the end of the, kind of around the laryngopharynx, that last part of the pharynx, the respiratory and digestive systems diverge. The respiratory system is ventrally located, the kind of larynx and trachea in the front, and then the digestive system, the esophagus, is a little more dorsal. So we'll look at the larynx next, and the larynx is it's a series of cartilaginous elements. There's 3 single pieces of cartilage. The thyroid cartilage, that's this big one, kind of makes most of the atoms out there. That's your thyroid cartilage or thyroid shield. Then there's a single epiglottis, which is a leaf-shaped bit, and I'll show you the pictures in a bit, but basically what it does, remember you got a common passageway for food and air. Well, you've got all this work to filter the air. You don't want bits of food getting down your airways either. That would cause some problems. So part of the swallowing reflex, if you watch someone's larynx when they swallow, the larynx is pulled up by muscles. And part of what happens when you swallow, the epiglottis, it moves. It's like a little lid. When you're breathing, it's open, but when you swallow, the swallowing reflex closes it, and that's going to help divert food dorsally back to the esophagus. So it helps to prevent food from getting into your esophagus. And then there's a cricoid cartilage, which just seems like a heavy ring. If you look at it from the anterior view, in the back, it gets a little blockier. There's a couple of other paired pieces of cartilage we'll look at on the model. It's the corniculate and the retinoid cartilage. Those have muscles and they kind of articulate together. They're attached to the vocal folds and vestibular folds. So they help control the tension on your vocal cords to, for vocalizations. So larynx. I'm just going to draw it like this. Oh, my board's dry here. I'll probably have to take a break here in a minute. I've got to repaint my wall. It's kind of cleaned off most of the paint. But if you imagine the larynx, I'm just going to draw it like this. A bump, a little bump. All right, so this is kind of a section, right, through this way. So you're kind of looking at the larynx. Imagine if I cut it this way. Now, a couple things to note. First of all, adult humans have what's called a descended larynx. Now, we don't get a chance to look at the cat, unfortunately. Most of the mammals, the larynx is actually up above the soft palate. That's why most of the mammals are obligate nose breathers. They really can't breathe through the mouth well. They also don't get food and they don't choke as easily as we do because it's much more harder for them to get food in the airways because their larynx is way up here. Now, it's kind of cool. In newborns, babies, their larynx is way up here, like other mammals. It's up above the soft palate that kind of closes around it. The advantage of that, they can actually nurse and breathe at the same time. You try it, it's not going to work because our larynx is too low. But about 6 months of age, the larynx descends. So the landmarks are quite different in a human and in a cat or other mammals. But a couple things to notice in the larynx. Again, I'll show you the cartilage bits later. I can't draw them. I can barely draw anything. But there are a couple of folds in the larynx. The anterior folds here are often referred to as vestibular folds or false vocal folds. They don't play much of a role in making sound in vocalizations. I think a few glottal sounds might come from them, but not much. They are high pressure valves. What happens, these things are muscles that can make them close, and if you contract the muscles of your chest, your trunk, you pressurize the lungs, and then you can release them and blast the air out. These vestibular folds or false vocal cords, or false vocal folds, I should say, they're used for a couple of things. One, for the coughing reflex. If you get foreign material into your larynx, bits of food, hamburger, what have you, you don't want them in there, you will initiate a coughing reflex. There are receptors in there that will detect this foreign material. In the coughing reflex, you close these vestibular folds, pressurize your trunk, and these days you should be wearing a mask, but you blast out the debris. That's the idea. You also use these when you're spraying, if you're lifting up something heavy, your trunk's kind of squishy. It's not a good anchor for the lever system, for the muscles. So you will close the vestibular folds, contract the muscles of the trunk. It makes you more stiff. It makes the trunk sort of more rigid, a better anchor for lifting things. Defecating, the Valsalva maneuver they call it, to increase abdominal pressure. You close those and strain, and that's the Valsalva maneuver. Those are all for the vestibular folds. The second set of folds, these are called vocal folds. As the name implies, there's some tightly strung ligaments that kind of project into the airways. When air moves across them, they vibrate. The rest of the upper respiratory tract can modify those sounds. So you can vocalize, you can make words, you can speak, that sort of thing. That's the vocal folds. Their tension is adjusted by some of those smaller cartilaginous elements. And what's kind of cool, you know when you see a coyote and they always show pictures of them howling at the moon? They're not howling at the moon. You know why they do that? Their larynx, again, it's up above their soft palate. If they just howl like that and go, come out their nose, they sound kind of whippy. Part of what they're doing when they lift their head up, they're disengaging the larynx from the soft palate so it drops down a little bit, so the howl comes out their mouth. We don't have to do that. Ours is already down there. So those are the vestibular folds and vocal folds. Again, vocal folds for vocalizations. The rest of it, I'll look at just with some pictures, just to describe the cartilage real quick. Then we'll go down to the trachea next. So let me finish up with some pictures on the small screen. Alrighty, here is one of the models we use in the lab of the larynx, and it's of course on its side. The landscape view is a little better. This here, this is a hyoid bone. That's what the larynx is kind of held in place with. It's anchored up to the hyoid bone here. And now this is the anterior view. You're seeing some of the cartilage. This little leaf-shaped bit back here, that's the epiglottis. There's your thyroid shield, and that is the cricoid cartilage. Below it will be the trachea. Then this is the posterior view. Again, you can see the epiglottis, hyoid bone. The thyroid cartilage doesn't project all the way to the back very well, but this big blocky thing here, that's a cricoid cartilage. And these little bits here, those are those paired bits of cartilage. From here to here are the arytenoid cartilages, and those are the corniculate cartilage, which will control these vocal cords, which would be in here somewhere. Now let me switch to a different view of a cadaver. All right, I'll send out an announcement in a bit, but I'm not using a cat model anymore. There's no point because we use cats for dissection because they're easy to get, but since we're not dissecting anything, might as well use a human. It's human anatomy. So here you see this section, it's through a human cadaver. There's your tongue, there's your soft palate and hard palate. So just a few parts are showing you here. There's your hard palate, that's bone. Soft palate would be back here. This is a nasal cavity we talked about last time. I looked at it in a model. Here are the concha bones in a cadaver. There's your superior concha bone, your middle, and whoops, let me slide back a little bit. We don't have everything in here. There we go. Superior concha bone, middle concha bone. There's the inferior concha bone. You have the palate before, I might have missed it. There's your hard palate, soft palate, right there. Now here we're starting to see the larynx. It's down here. There's your little epiglottis, a little flap-like thing. When you swallow, it closes down and it covers the opening of the airways here. These are the parts of the pharynx, nasopharynx in blue, oropharynx, and laryngopharynx here. There's your epiglottis again. There's the larynx. You can see the epiglottis. They are separating different types of cartilage here, a few sinuses. Let me go on to the larynx. So here we go. Anterior view, there's your cricoid. There's your thyroid cartilage, and there's your epiglottis. Trachea there with the hyaline cartilage rings. We'll talk about that shortly. And here's a posterior view. Those are the arytenoid cartilages. And there's your corniculate cartilage and the cricoid cartilage from the posterior view as well. We'll start looking at the trachea and the rest of the airways and lungs next time. Take care.